suhoor, the pre-dawn meal, should contain foods which should provide energy continuously for many long hours. So it should be comprised of high energy complex carbohydrate meals. Many of the foods which we have mentioned are according to the Quran and Holy Sunnah. We should try to include the foods which are healthy for us so as to make a balanced diet during Ramadan. Many of the foods which have been mentioned in the Quran are dates, milk, lamb, oat, barley, and fruits and figs. The lamb and mutton has also been included, but nowadays fish have been promoted because it does not require slaughter as per the rules, Islamic rules. Now we talk about common health issues during Ramadan. First of all, let's take heartburn. This is quite common problem faced by the people during Ramadan. Usually fasting leads to decreased production of acid in the stomach, but the smell and thought of the food can lead to increased acid production. Thereby, some people can feel more heartburn during this fasting. Those persons who have been earlier taking either antacids, antihistaminics, or proton pump inhibitors for their acidity problems should continue to take them at the pre-dawn meal so that they will not face the problem of acidity or belching during the whole day. It is also advisable to avoid caffeine and nicotine during the whole month of fasting because they promote the acidity in the stomach. For avoiding belching or burps, the peppermint can be used, which will help in easy digestion of the food or propulsion of the food from stomach to intestine. Constipation. Constipation can be a quite irritating problem during the period of fast. It can be avoided by taking lot of fluids outside fast. All the foods which are rich in fiber, bran, etc. will help you to keep your motions in a regular habit. If the problem persists, a short course of bulk laxatives can be taken to tackle this problem. Diabetes. People who are known diabetics, those who are taking various types of insulin or tablets for diabetes, should consult their doctor before starting the fasting phase. Those persons who are on injectable insulins should either avoid fasting or they should take help of their physician to maintain their regime as per the intake of the food. For those persons who are taking oral tablets, the tablets can be tailored according to their food intake and the timing can be appropriately maintained. It is always essential to check your blood glucose during the phase of Ramadan so as to keep your blood sugar within the target limits, and also to avoid hypoglycemias. Hypoglycemias are precipitated due to fasting if a person is also taking long acting tablets. So with the help of your doctor, you can change onto a short acting tablets. Provided if you have a hypoglycemia, it is always essential to keep along with you certain sugar tablets or sugary fluids to be taken to avoid the risk of hypoglycemia. If you have other complications along with diabetes, kindly consult your doctor before going on for fasting. Other minor problems which we can face during the Ramadan are headache, stress, dehydration, increase in weight or obesity, and sometimes exacerbation of chronic problems. For avoiding headache and dehydration, we should adequately hydrate ourselves during out of the fast phase and keep ourselves happy and cheerful, and we should be involved in our day-to-day activities to avoid the stress and headache. For chronic problems, those patients who are already on medication like for blood pressure and asthma, you should essentially contact your doctor to pre-medicate them or to make the medicines at the time of out of fast phase, so you should not land into an asthma attack or stroke. These all problems can be avoided or prevented by keeping ourselves more in a preventive mode and asking our doctor to how to keep our fasting safe and healthy. We advise you sincerely, if you are into advanced disease, kindly consult your doctor and do not land yourself into trouble. Thanking you. This is from Aster Medical Group.